Welcome to the Wake Her Up webinar with Joy Women's Wellness. We are so thrilled to have everyone here. Um, I am Marcella Hill. I am the founder of Wake Her Up. We have a community of over 53,000 women across the globe in this Facebook free community talking about perimenopause and midlife and what in the hell are we doing about it to feel good. And we're so thrilled to be talking to three physicians today about hormone therapy because there is a massive amount of confusion. We all feel lied to, we all feel dismissed. We have all sat in doctors' offices, felt like we couldn't ask questions, and now we're finding out how much we need to advocate for our own health. But it gets a little bit tricky because we want to come in like guns a-blazing, being advocates for ourselves, but we also have to learn a balance between trusting advice from physicians and knowing that they care, knowing that they have our best interest. And that's why we're having this webinar today, because I want you to get to know the types of doctors that Wake Her Up lists on our directory. I want you to know how to work with a doctor that actually is here to help you and also advocate for yourself. So today we're going to be answering all the questions about what is and what isn't, all the newest research about hormone therapy, where to start for your own personal journey. The big question of, does it cause cancer? We always have to address that. And are you too young? When do you need to stop, or if ever? And the big one is how to work with providers that actually are going to help you and where to start with that. So today we have amazing physicians with us that are providers for the telehealth company Joy Women's Wellness. To start off, we have Lindsey. Lindsey is a board certified family nurse practitioner with over 16 years of experience. Specializing in hormone optimization, peptide therapy, and lifestyle medicine. She holds multiple certifications in nutrition, precision medicine, and exercise, including CrossFit, level 2 coach certification, and is currently obtaining her doctorate in lifestyle medicine at Florida State University. Lindsey empowers individuals to take ownership of their health through personalized care plans rooted in the art and science of medicine. Lindsey, you are like the doctor that we all hope to find. Honestly, it's just so nice to know all of these women have gone out and gotten very specific education to help women. Kimberly, hi, Kimberly. We're so glad that you're here. Kimberly's journey into health and wellness began after high school knee surgery or a knee injury, which sparked her interest in recovery and healing. She pursued health promotion at Virginia Tech and later earned her nursing degree at Johns Hopkins University, eventually becoming a nurse practitioner, specializing in sleep medicine. Hallelujah for that. And founding Ember 28. Kimberly has focused on addressing women's health challenges, including pelvic floor dysfunction, hormonal imbalance, and weight loss resistance. Thank you so much for going and getting specialized in all the things that women need. We desperately need you. And all these women also have their own experiences going through perimenopause and health challenges, and that's why they're here. Susan, welcome. I'm so glad you're here. Susan is also a board certified family nurse practitioner with nearly 40 years of healthcare experience in a diverse array of clinical specialties to include bioidentical hormone replacement therapy, integrative medicine, regenerative medicine, urgent care, family medicine, medical aesthetics, trauma. The list just keeps going. It's beautiful that you have specialized in those things. And you also have had your own challenges. And I think that's what makes all of you so unique in helping women to trust you, that we can connect with you. You're not just there with a clipboard being like moving along in 15 minutes. So with that, I'm going to turn it over to Lindsey and we're going to jump right into answering your questions.
Yeah, so I'm so excited to chat with you guys. You guys have the privilege of I'm 38, so I'm in those very beginning stages of perimenopause, and then Kimberly is kind of right in the thick of it, and then Susan is postmenopause. So we've tried all the things and know exactly what you guys are experiencing. So I'm going to kind of touch on just what are hormones that you should be paying attention to. And a lot of times I think we tend to just think about our sex hormones. So maybe estrogen, progesterone, testosterone, and we tend to neglect a few of those are really important, but we tend to neglect a few of the other ones like our cortisol, our thyroid, and our insulin. So I'm just going to kind of give you a brief overview of what hormones we tend to focus on at Joy and what we really think that can help you fight your brain fog and energy and mood and metabolism, which I don't know any middle-aged women that aren't worried about their metabolism and the weight gain in their abdomen. So first off, I'm just going to start with cortisol, which is the stress hormone. So it's a good hormone. You want to have some cortisol because it helps regulate your energy and it does help you run from a bear if you're getting attacked in the woods. But it can also kind of wreak havoc if you have a cortisol imbalance. So if you have really high cortisol or really low cortisol, then you're going to get that chronic fatigue, anxiety, trouble sleeping, belly fat, really that like you're like wide awake at nighttime, but it's time to go to sleep, or you're experiencing energy crashes. And this is really where lifestyle plays a huge role. And we know that you can't just like go quit your job and stop being a mom and stop caring for your parents. Like part of that is just life. But learning how to maybe take some supplements and adaptogens to help with that, or doing some stress management practices like breath work, meditation, going and put your feet in the grass, getting some morning sunlight, like all of those things are going to help with that cortisol because what we see is if that cortisol is just chronically elevated, it can really wreak havoc in your body and it does affect those sex hormones. If your cortisol's really high, it's going to affect your adrenal glands and it's going to affect your testosterone, which is what a lot of you are come to complaining about us too. Like you just lost that zest for life, your sex drive, all of that type of stuff. That excess cortisol also raises your insulin. And a lot of people really struggle with weight loss because of insulin resistance. And when that estrogen declines, when you hit your 40s, you're more tend to have insulin resistance anyways. And so it's a hormone that you really want to be paying attention to. And it's really what's going to drive that weight gain around your abdomen, those sugar cravings, brain fog. So when it comes to control, well, one, you want to test your insulin. I will tell you that most doctors don't ever check a fasting insulin level, like ever. But that level raises about 10 years before you ever become diabetic. And so we really want you to focus on like eating a really high protein diet, really aiming for that like 30 to 40 grams of protein at your meals, getting your fiber, healthy fats in. Strength training is so important so you can pull that glucose into your muscles. And then supplementing with like a berberine or chromium, or this is where GLP-1s can come in really handy if you have that chronic elevated insulin level. Because here's the thing, no matter how much you diet and exercise, if your insulin is really elevated, you are not going to lose weight. And it is so frustrating for a lot of you women that we see. And so GLP-1s get I don't know, maybe a lot of people are like embarrassed to take them, or there's a lot of this just like scrutiny around them, but they use it with a healthy diet and supporting all of your other hormones can be so beneficial for you.
Lindsay, can
Then
I
you
jump
like,
in
yeah,
real quick? My
yeah,
sister
go for it.
has had a weight issue for years and years and years, a lot from trauma and loss of children and things like that. But she has done surgery, like a gastric bypass surgery. She has done the diets. Like if there is somebody that sticks to diets, it is her. And she started a GLP-1 just a few weeks ago, and she called me and she's like, I don't know if I should be excited or pissed off, but I've lost 15 pounds in 2 weeks. And she's like, what the hell? Like, I have dieted for years. I have stressed my body and done the gym thing and outdoorsy and, even decrease stress. And I get on a GLP-1 and I can finally lose the weight. And we started talking about how our bodies, it's me and my sisters and my mom, we just have high cortisol levels. We just do not process food properly. And so it just kind of didn't matter what kind of diet we were doing. Our bodies just like really like sugar. And she was just so thrilled and mad. But yeah, it works.
Yeah, and the reason that's so drastic weight loss is because when fat cells get filled up with insulin, they just become these like big puffy, like think of it as a balloon. And so when you can bring down that insulin levels, those fat cells just like shrink and you can lose weight like that. So they're pretty
It feels like
magical if
that.
they're done right. If they're done right. Um, then we really have to pay attention to your thyroid, and this gets really confusing. Kimberly is like the thyroid expert here, but your thyroid is your master metabolism. It controls your temperature, your energy production, and sometimes it's really hard to tell if you have low estrogen or hypothyroidism because a lot of the symptoms mimic one another. So if you have hypothyroidism, you could have brain fog, dry skin, depression. And when you're working with a provider, you can't just get a TSH tested. That is really essentially just like a screening for your thyroid. You really want to dig in deep and get a free T3, free T4, and check those thyroid antibodies just to see what's really going on in with your thyroid. And then really focus on supporting your adrenal glands. Your gut health is so important with thyroid. Getting on the right thyroid medicine. A lot of people will just give levothyroxine, and women tend to do better with some T4, T3. And then supporting your thyroid with certain supplements like iodine, selenium, zinc, and yeah, so that like just don't overlook your thyroid, especially as you're going through perimenopause, because those drop in hormones can really affect that thyroid function. And then lastly, we have our three hormones, which I'm just going to give a brief overview of them because Susan is really going to deep dive into estrogen and testosterone. But progesterone declines first, essentially. Progesterone and testosterone decline first in your late 30s. And so progesterone is that calming hormone, and I don't think it gets talked about enough. So many women, their providers are like, you've had a hysterectomy. I don't even want to talk to you about progesterone. And they're really missing this aspect of hormone therapy. And progesterone does a lot for you. One, it balances out that estrogen, it helps you sleep. It helps keep you calm. It reduces your anxiety. And if you're having those heavy, irregular menstrual cycles in perimenopause, it can really help regulate those menstrual cycles rather than just going on like a birth control pill that sometimes our physicians tend to just shove on us, right? It also is what's causing a lot of your night sweats. Maybe not hot flashes, but night sweats. And so a lot of times in perimenopause, your estrogen is just like up and down, and you'll get this estrogen dominance. And that's where progesterone can come in and really help support that. But again, this is where I'm going to talk about stress and the fact that cortisol steals progesterone from you. So again, like we've talked about stress impacting your insulin. We've talked about it impacting your thyroid. Now I'm going to talk about it impacting your progesterone. So that cortisol is one that we really have to pay attention to. So just you're not like I'm on progesterone. There's not really an age that like you're too young to start progesterone on. We use it to support pregnancy. We use it to support heavy menstrual cycles. So just know that that is out there for you. Then we dig into testosterone, which declines next. I'm on testosterone. I've been on testosterone for 2 years. Like, I think my testosterone was three. Again, like some of it is ovarian function, some of it's stress, right? I'm sure mine's stress. I have three kids, work full time. But testosterone is really the one that's going to give you that zest for life back. It's going to help support your muscle mass, your mood, your libido, fatigue. So supporting your adrenals and strength training can definitely boost that testosterone. But it's something that's really important in women. It's not FDA approved for women, which is unfortunate. And so you have to get it through compounding pharmacy or off label your has the dosage of men and take a tenth of it and try to figure out what a tenth of a men's dosage looks like. But it is really needed in women. And Susan's really going to dive into how you can get that delivered and the importance of it. And then lastly, we have estrogen, which is so important. It does not cause breast cancer. So estrogen is a growth hormone, but it doesn't cause breast cancer. It helps protect you against cardiovascular disease, cognitive decline, diabetes, osteoporosis. It just does so many things for you, and it helps you feel so much better. It can help with those hot flashes, night sweats, the mood swings, the vaginal dryness, all of those types of things. And it's really only contraindicated if you have a personal history of an unprovoked blood clot or a personal history of breast cancer. Just because your mom and sister had it doesn't mean that you're not a candidate for it. It might mean that you need a little bit of a further discussion with a provider, but it's so essential if you're looking at your health and longevity aspect of it. So I'm going to kind of hand it off to Susan and let her talk about how you can get estrogen and testosterone, and she'll dive a little bit deeper into both of those.
Great. Thanks, Lindsay. Thanks, Marcella, for putting together this group so that we could chat and get to know them and that they can get to know us a little bit better and how we approach taking care of the patients that we see. So just as Lindsay spoke about, testosterone is a powerhouse hormone. Everyone tends to think about it as something that men get on to help out with muscle growth, to help out with energy, to help feel like they are a man. But it's actually one of the hormones that tends to wane when we reach our 30s. Many women tend to have low testosterone. I'm finding even more so these days. Being on oral birth control pills, whenever you're on that, it tends to decrease the natural production of hormones in general in your body that the ovaries produce, testosterone being key. So if you're on a birth control, it could be a combo hormone where estrogen and progesterone might be given to you, but there's never testosterone that's replaced. So your testosterone, I find with women on birth control pills or any kind of birth control mechanism, will have very low testosterone. When your testosterone levels are low, you're going to feel fatigue. You're going to feel with poor sleep. You're going to have low motivation and drive. And don't forget also the role that libido plays into it. So if you're wondering why your libido is tanked, it could be your testosterone. Could it also be your estrogen? Possibly. But that's something to take a look at even further. Making sure that you're on enough testosterone to help support your body is very individualized. So I don't know what your baseline is. You probably don't even know what your baseline is. So getting to know kind of what your levels are, and not just working off of your levels, but also listening to your symptoms. Lindsay's already talked about, fatigue being a very common symptom that all of us are experiencing. When your testosterone levels, you can have fatigue, but also when your thyroid is low, you can have fatigue. And also when your estrogen starts to deplete, you can have fatigue. So we really have to dive into what is it that's causing fatigue and the contributory factors. And if testosterone is appropriate, then by all means, let's get some testosterone on for you. Some areas where we need to be a little more careful about the testosterone and its use is if you have a condition where you may be more androgen dominant. A lot of PCOS patients tend to be a little more androgen dominant. Now, I think of PCOS as like a spectrum. So you can have some of the qualifications of PCOS. You could have the ovarian cysts that occur. You could have a lot of androgen type symptoms, acne breakouts, hair production, fat deposits, or you could have just some of the ovarian cysts, but not necessarily the high androgen levels. So it really takes looking at the whole picture. When I'm looking at testosterone for women, it comes in a couple of different forms. We have two here at Joy. One is creams, a topical cream that you would apply daily, sometimes twice a day, depending on what your symptoms are like. And then we also have subcutaneous injections. The injections typically are about a once a week subcutaneous, being it goes into the fatty tissue, not into the muscle. And you do that just about once a week. Sometimes if you get a little bit of a tail of your symptoms, I would say about a couple of days prior to your next injection, we could consider doing biweekly injections. So again, working with your provider to find out what's going on with your symptoms when they occur, and if the therapy that we put you on provides you with that efficacious result. When you think about levels in addition to symptoms, really, some women feel great when they're at 50. Some women feel terrible when they're at 50. Some women feel great when they're at 100, 150, 200. Some people feel better at 300. It's really just finding that sweet spot for you. Now, just because you don't feel the best, let's say at 150, If you get to 300 and you're still not feeling best, it doesn't mean that more is going to be better. It could actually be you're too high and your body is not at its optimal because you're too high. So don't think of just because I'm not reaching my point that, it's because my level's not there. We really need to take a step back and dial it further back and determine, is it because my vitamin D level is low? Is it because my thyroid is low, or needs some support? Is it because my cortisol levels are high? So you really have to look at the whole picture. All of us here at Joy really work with patients on their symptoms, not just their levels. So you could come to us and say, I feel absolutely terrible and my testosterone level is 50. Okay, well, maybe 50 is just not your number. Okay. So again, looking at the whole picture related to testosterone. The other hormone that's important and everybody thinks about, this hormone for women, again, 95% of it produced by your ovaries, is estrogen. Balancing out estrogen. And it tends to be the one that fluctuates the most when we're in perimenopause. And it also tends to be the one that gives us some challenges to try to support in perimenopause. Once you get into menopause, we kind of can dial you in a little bit better because you're not having those changes continually. But when you're in perimenopause, you're like a moving target. So I try to make sure that our patients know to be patient with that process. Just when we think we have you dialed in, your body could take a dip and decide, I'm not going to produce even another 40% of what my ovaries are currently producing. So don't be alarmed if your symptoms do change when you're in perimenopause. We kind of expect that to happen. You have to be really good. And it sounds like this group is keeping a journal, a diary of your symptoms, knowing when they happen. Does it happen in the follicular phase of your cycle? Does it happen in ovulatory phase? Does it happen in the luteal phase when your estrogen tends to drop significantly as you prepare for a menses to occur? Am I having regular menses? Am I not having regular menses? When is it appropriate to be put on estrogen? A lot of it has to do on whether or not you're developing estrogen type symptoms that are low. Many times when your estrogen levels are low, you can have hot flashes, night sweats, vaginal dryness. When your estrogen levels are too high, you're also going to be symptomatic. That's going to be breast fullness, breast tenderness, midsection weight gain, a little bit of irritability, water retention. So you have to be really astute with your body and what's going on with your body and knowledgeable about, is it too little estrogen or is it too much estrogen? Estrogen becomes extremely important as we get into menopause, out of perimenopause. That's when your ovaries are not producing anything and they stop functioning. And your FSH, which is the follicle stimulating hormone that lets us know that your brain thinks that your body is not getting enough of the hormones that your ovaries used to produce, we'll monitor that. The more that we can manage that to an optimal level, between 10 and 20 is pretty optimal in menopause, is going to be the most beneficial for you as a woman. Ideally, we're trying to get estrogen levels to be functional so that you have the cardiovascular benefits. You have that lipid stabilization. You have that bone density support, which is what we're trying to accomplish with your estrogen. Estrogen levels really targeting between 70 to 100 in menopause is really where we get those benefits. Also that brain health and that brain protection, so that we can decrease the incidence and the development of dementia moving forward.
Susan,
Yeah.
can you say that range again for estrogen?
Yeah, estrogen, I tend to target anywhere between 70 to 140 in menopause.
And
That
do you
seems to
have a
be
target range for testosterone? Like, where do you see women feeling good?
anywhere between 50 to 200 is a big, broad range.
Right.
Again, I'm working off of symptoms. Really a little bit more with that testosterone than I am. Mine fluctuates quite a bit. And I know when I feel really good, and I know whenever my levels are way too high, and I know that it needs to dial back. So you have to really be in tune with your body.
I think that's the one thing that I've gotten out of this is being in tune with my body. In fact, last night
Yeah.
I was scratching my legs and my husband goes, "Are you scratching your legs? Have you taken your testosterone?" Like that's the first sign. Like if I scratch my legs at night, we know Marcella's testosterone is low. And then I'm like, "Oh yeah, all these other symptoms, but it's the scratching the legs." So my husband's like, You didn't take it, did you?" I'm like, "Damn it." So
Love that your
yeah,
husband knows that.
I
I
was just going to say that.
he knows because I'm like, "Stop scratching her legs."
I did want to jump in while we're doing it and say, because someone did ask about progesterone's a really hard one. So I'd love you to talk about that too, and like ratio and
I
what
think
Definitely.
one of the
So
biggest things that comes up in my group that's really confusing is that you've got a doctor that's like, oh, you don't have a uterus, no progesterone for you. And then you'll go to another doctor and they're like, you should absolutely be on progesterone. So if you can explain why is there so much confusion? Why do some doctors think we should and shouldn't? Where does that come from?
a lot of it is based off of how they were trained, and to be honest, there really isn't a lot of medical training that occurs in medical school, specifically about hormones. You're going to get me on another soapbox here about our pharmaceutical industry and how our education for medical professionals is geared with the pharmaceutical industry, which promotes giving synthetic hormones, which is not helpful to your bodies. Um, Progesterone, as Lindsey mentioned before, and as we all know, is like a vital hormone for your body. It is that calming hormone. And it's not just a hormone because your ovaries or because you have a uterus. We have progesterone receptor sites all over the body, in your heart, in your lungs, in your brain, in your tissues, and your uterus, of course. So the school of thought, whenever they were doing the women's health study, was to give some estrogen, protect the uterus because estrogen is proliferative. It'll increase the uterine lining. So progesterone will calm that down and ease that uterine lining, so it doesn't become too thick in production, leading into endometrial, cancers, because again, cancer is that proliferation of cells. So it was to be more protective. And so the thought process was thinking just the uterus. Obviously, as time goes on and as we do more studies, we find that progesterone can be beneficial to other parts of the body. Even in men, progesterone receptor sites are found and can be helpful for, issues with sleep. So just as we take like 1/10 of a dose of their testosterone, they can benefit from 1/10 of a dose of our progesterone. So some thought processes for men as we're moving forward, and how we can support them. One little side note about progesterone and its effect on your body and lung tissue, specifically during COVID. There was a study that was done about men who were in ICU. Women in ICUs were able to get out sooner than men. And they ended up injecting progesterone into men in ICUs to help out with their lung resistance and their lung recovery. And they were able to get out of ICUs because of it. So again, another push for progesterone as a hormone that our bodies need and are utilized not just within our uterus. We do have the approach here at Joy that if you are on estrogen, that we will also supplement you and support you with progesterone. So those two have to go hand in hand, with or without a uterus. And again, because a lot of us believe in that thought process that we want to protect not just uterine tissue, but also the tissues throughout your body.
On the note of progesterone and being aware of your body, I think a lot of people will start, I've seen between 100 and 200 milligrams of progesterone. And when you start being attuned to your body and feeling safe with hormones, for me, I started at 200 and it would make me feel almost tipsy at
Yeah.
night.
Yeah.
And then I would feel really groggy in the morning. And so I lowered mine down to 150 and I tried it at 100. It wasn't enough. I ended up like 150 is my really sweet spot. And so I think that's something I love about Joy is that you guys empower women to be like, what do you think? Like, where do you want to be? This is what I suggest, but like, you're really trusting women to get in tune with their body. And it helps you as a physician for women to know their body.
Absolutely. I look at it, we all look at it as a collaborative effort. You know your bodies better than anyone, and maybe even your husband, from what I've heard. But we know our bodies and we know what we've experienced, and we know the medical side of it. So together we can bring that knowledge and figure out what is the fine-tuned plan for you specifically. It's not a cookie cutter approach. It's not like we put everybody on just 100 milligrams. I mean, we do have some thoughts on starting doses based on symptoms, but really it becomes a fine tuning, collaborative approach between your provider and you in figuring out what works best for you. Some symptoms, just like you described about the progesterone, if you're feeling a little groggy, maybe it's a little too much. Sometimes too much progesterone, even though it is a calming kind of hormone, can be a little too much, a little more of that bloating that occurs. Think of progesterone, it's highest in that luteal phase when you're preparing for potentially implanting an egg to become pregnant. Might make you a little hungry, can make you feel a little lethargic, a little low in energy. So you got to be careful about not putting too much of it into your body and really just getting a good fine balance between that estrogen and progesterone. Ideally, the estrogen to progesterone ratio, if you do like it's like a progesterone nanograms per milliliter to estrogen in picograms per milliliter, you're looking to get to a ratio of about 100 is optimal. Anything between 100 and 500 is really that ratio that you're looking at. And a calculation that you can do to kind of figure what that is. There are all kinds of like online calculators that you can do. The one that I tend to like go to very quickly is the Omni calculator. But if you're good at math, you can just take your progesterone at that nanograms per milliliter, multiply that by 1,000, and then divide that by your estradiol level at picograms per milliliter, and it will give you what your ratio is.
This is awesome. And for anyone that's like, wait, what are we doing? Suzanne, who also works with
Yeah.
Joy Women's Wellness, she is
Yeah.
like really well lays things out like this really well inside the Wake Her Up Facebook group. So after this, I'm gonna go be like, Suzanne, can you break down that ratio? And you can find it there in the Wake Her Up group. So if anyone's like, wait, just come there, we'll break that down for you.
Great. So jumping back into estrogens before I turn it over to Kimberly so she can pick up on her end there. Estrogen comes in the form of a couple of other modalities. So we have cream applications, and this is for estradiol, I'm speaking of specifically. Cream application, topicals, we also have patches. Those are the two that are transdermal. And anyone who has a family history or even a personal history of breast cancer, I tend to go with something that is a little more with a higher safety profile. So again, bypassing liver metabolism, which will happen even with your oral bioidenticals, will decrease that risk of increased sex hormone binding globulin production, as well as a little bit of a clot piece. So topicals, creams, patches, oral pills, and then we also have the injectables. I tend to, when I think about like, how do I want to start somebody who is just entering into perimenopause and is symptomatic, I get a lot of good relief, and maybe even only using estrogen during the times when they're having symptoms if I'm using creams or patches. I tend to move toward something other than patches, like an injectable, once I know that we need to get higher levels of estrogen and they require support. Estrogen injectables are going to last longer than, a topical cream that you put on daily, or a patch that you change out twice a week, or an oral pill that you take daily. And because it has like a good, 4-day half-life, it's going to be in your system longer. Typically, you start off with a once a week subcutaneous injection, very much like your testosterone. But again, if your symptoms are starting to wane a couple of days prior to that next injection, then we could consider biweekly. Could you do 3 times a week? Possibly, but I tend not to want to stack it up too much more than that, because again, you're layering your doses a little higher, and then you get into the issues with too much estrogen or estrogen dominance. You could have issues with mid-cycle bleeding. You could have some hyperplasia in your uterine lining, and you really have to be careful with it. So close monitoring, close observation with those estrogen injectables. Where I have found it to be my go-to is when I have women that are severely symptomatic. Patches are just not cutting it. They're on the highest dose of oral preparation. Perhaps their body's not digesting or processing that oral preparation. Their SHBGs are so high because they're on an oral preparation that they need a higher dose. That's where I feel like that injectable is going to be my go-to to give them that relief. And I like to save it and use it at that point in time. Again, making sure that we balance out that progesterone as well when they're on it.
Amazing. This is such good information. And I just want to encourage everyone, because we're like throwing all this information at you. When you come to the Wake Her Up Facebook group, this is a continued conversation. This conversation is happening all of the time to be able to answer questions like this and get you the information. So if you're like, whoa, please just know this is a continued conversation with physicians, with specialists and experts. So come over to the group and we'll continue that. So thank you so much, Susan, for all of
You're
that
welcome.
information.
Yeah,
Kimberly,
no
let's turn it
worries.
over to you. You're muted. I can't hear you.
Sorry, guys. I'm so glad to be here. Thanks for, I'm glad everybody is spending time and feels that this is important. We're super passionate about women's care at Joy. So I'm just going to speak for a few minutes, but I wanted to just go over some highlights, some 5 key takeaways that will help you be successful with really all of the treatments that we've talked about. And I did want to just chime in one little thing about progesterone therapy if you don't have a uterus. I personally don't have a uterus. I had to have a partial hysterectomy when I had my last child. I still have my ovaries. Progesterone literally saved my life 4 years ago. I was about to divorce my husband, who I actually truly love. I think he's still hot, like as hot as he was the day I met him. He's great. He does a lot of things, but like 2 weeks out of the month, I literally wanted to stab him. I was like, if this dude walks by me, like he's done for. And I was just like a different human 2 weeks out of the month. I didn't have a period, so I wasn't bleeding. I was still cycling, but not bleeding. So it really felt like it was coming out of nowhere. And I honestly know more about my menstrual cycle now than I did when I actually was having a period. So I found progesterone and it literally saved my life. I will never, ever not take progesterone. Okay, that's one of my soapboxes. My other like biggest pet peeve that I'm going to talk about with testing and tracking your hormones, so that testing is really important. Obviously, you guys are aware that we test hormones. We are not going to ever tell somebody you don't need to test your hormones. They change all the time. Yes, that's true. But if you kind of know where you are in your cycle, so it's always a good idea if you can to track where you are using some sort of app, so that when you do get your blood work, we can help you understand if your estrogen, progesterone look like a good number for where you were in your cycle. And then definitely a full thyroid panel, like Lindsey was mentioning. When people are like, oh yeah, I was told my thyroid was fine, it's just a TSH, it's really not helpful. So you need a full thyroid panel, which we do in our advanced and comprehensive panels. Prioritizing strength training and protein. You guys have probably heard this. It's pretty big talk on Facebook and Instagram. I think the word is out that everybody wants to eat or aim for about 1 gram of protein per ideal body weight as much as you can. Don't expect to be able to do that right out of the gate. If you aren't currently hitting that goal, it takes time. Your digestive system sort of has to wake up and be able to digest protein. If you have no idea what you're eating, then you might want to download a Chronometer or MyFitnessPal and get a food scale and try to understand how much protein you're eating. Other things I like for muscle support, too, is obviously resistance training. And outside of the protein, heavy lifting. So not like your 5 or 10 pound dumbbells. We're talking about heavy weights. So ideally you want to work up to only being able to do like 5 to 6 reps in a set approximately. Again, if you're not doing that right now, you want to enlist some professional help so that you don't injure yourself, but that's sort of a loose kind of definition of heavy lifting. Amino acids and creatine are probably some of my favorite go-tos in terms of supplements to support muscle growth and health. Okay. Managing stress and sleep. You've heard us mention this a few times. This goes along with cortisol and progesterone balance. This is huge. Stress will literally rob you of everything. If we're putting you on hormones, but you are not addressing any stress, you're just not going to get all the benefit and out of the hormone treatment that we're hoping you get. Okay. Sleep, I'm obviously very passionate about it. That's how I started as a nurse practitioner. Sleep is huge. It is the foundation of health, just like your house has a foundation. If you are not sleeping, it is really hard for us to help you feel good. So we certainly spend a lot of time talking about that at Joy. We have lots of options to help you get better sleep. I'm going to save you guys my soapbox on sleep hygiene tips, but we can go over those at some point if we need to. Okay. And then detox pathways. This is really important. I wanted to spend at least a minute chatting about that. It's important whether you're on hormones or not, but this really happens with, this is where gut and liver health are really important. These are your main detoxifiers. So estrogen particularly goes through a pretty extensive detoxification um, process. So the first two detoxification phases happen in the liver, and the last one is mostly taking place in the gut. Okay, so phase one is called hydroxylation, phase two is methylation, and then phase three would be excretion, which mostly happens in the stool, but also in urine. So there are lifestyle ways that you can support detoxification. I would say the main ones are watching your alcohol intake, being aware of environmental toxins, reducing, plastics. So Environmental Working Group is one of my favorite websites if you're not familiar with that, and trying to evaluate products that are in your home environment or that you're putting on your skin. Okay, and they will give it a ranking as in terms of endocrine disruptor ranking, cancer ranking, things like that. Watching sugar in your diet, increasing cruciferous vegetables. Those are some big ones to help you push phase one down a preferred pathway. Okay. And then methylation, B vitamins are pretty big for that, magnesium, SAMe. And then phase three, just making sure you have adequate bowel movements every day. I can't tell you how many people I see every day, women especially, they're like, oh yeah, I poop like twice a week. That's how I've been all my life. It's fine. I've been told it's fine. It's not fine. It's not normal. So you don't want to recirculate estrogen. Okay. So hydration, fiber, again, this is where stress comes into play. A lot of women are very psychosomatic with their bowel movements. A lot of times, an example of this is when you travel, you tend to get off schedule. So, we can help you with that as well. And then last, make sure you're working with a hormone specialist. Obviously, we'd love for you to work with us, but making sure that you are working with a provider that really does seem knowledgeable. I would say most importantly, that seems like they are listening to your concerns. They're going by symptoms as much as lab values or potentially more. And making sure that they're also comfortable with treating thyroid. Thyroid is really important for a lot of women. Once you get into 40, a lot of women are struggling with a suboptimal thyroid function. Doesn't necessarily mean you need replacement right out of the gate, but you do need to get your levels checked and have somebody start having those conversations with you as well as your other hormones. All right, that was a quick and dirty, but I want to make sure we have time for questions.
That was awesome. Thank you so much. I think one of the things I want to touch on really quick is, when we're talking about hormones and perimenopause and all of this, it does feel like we're talking about every single symptom, every single aspect of life. And it does feel like this, we're talking about this miracle thing that fixes all the things. But if you think of perimenopause as this puberty, if you were talking about a 14-year-old, you would talk about them like they're a whole thing, right? I mean, they're hormonal, they want to hang out with friends. It's not separate issues. They're in puberty. And that is what this perimenopause phase is. It is your whole life. It is your whole thing. So it is talking about your marriage and testosterone. It is talking about sleep and stress. It is talking about everything because hormones affect your entire being. And so I like remembering that instead of trying to go through and fix all these individual issues. We're talking about how do you want to feel during perimenopause? That's what we're doing here.
Yeah, I think that's an important point. It's like there's not like one hormone that if you max out, like if you go to a 500 of testosterone, that doesn't mean you're magically going to feel well. It's like
Yeah.
you have to do all these things. And if you do the cortisol and the insulin and the thyroid, then your HRT will help better. It'll work better. And, I think, and that's what I love about our team of clinicians is like, they're not just focused on estrogen or testosterone. It's like you're a whole person. There's lots of parts. Like, yes, I can give you this, but you also need to look at something else.
There are a few people in the chat asking, like, where do we go for labs? What are you going to test? If you go to choosejoy.co and use the code Wake Her Up, you'll get 50% off your labs. And it's very clear on their website, like what's being tested and which labs you want. And you can choose which labs fit best for the information that you're wanting. If you've never had labs ever before, for me and a lot of members in the group, just doing the first initial like the cheapest one is a really great start unless you have some outstanding things that you're really wanting to know about. But yeah, choosejoy.co is where you're going to want to go.
Marcella, do you mind if I just say something? Yeah, so
Yeah.
I personally really prefer women especially to get advanced or the comprehensive if you're a new patient,
Okay.
because that will let us see your fasting insulin, triglycerides. Those are great markers for metabolic health, like early metabolic issues, like maybe your blood sugar is still fine, but usually maybe the fasting insulin and triglycerides are starting to have issues, so we can course correct early. And then a full thyroid panel is also included on that. And of course, cortisol as well, DHEA, so that's looking at your adrenal health. So it really, it helps us evaluate your 6 key players that we have talked about today. And that's a 30-minute visit. If you guys wanted more time with us, which we love, then you can do the comprehensive, which gets you an hour visit.
Yep.
Amazing. And
Kim, can you
anytime
mind?
what?
Oh, sorry, go
Katie,
ahead.
go ahead.
I wanted to ask Kim if she would explain the difference between immediate release and slow release
Oh,
progesterone.
yes. I'm sorry. I'm glad I was going to say that. So I'm glad you asked me. So this is talking about progesterone. So there are a couple of different forms. Just like Susan was saying, it comes in creams and orals. We usually use oral because when you metabolize oral, you have alpha metabolites that cross the blood-brain barrier and hook onto GABA receptors. And that is why progesterone helps you feel calm. It helps with anxiety, decrease irritability, and helps you sleep. And in oral, there's more immediate release, which is available through compounding pharmacies or retail pharmacies. And it is still body identical, which is great. But that usually wears off by the next day. And so personally, I like sustained release, which is only available through compounding pharmacies, especially if you have heavier symptoms of anxiety, irritability, so those daytime symptoms. It tends to give you a little bit better coverage. I have found personally and with my patients. The immediate release is still great for like if you have heavy bleeding or shorter cycles, maybe you have just trouble falling asleep, but once you're asleep, you can stay asleep. So again, this sustained release sometimes is more helpful for women that maybe they fall asleep fine, but they're up at like 3 or 4 o'clock in the morning and their brain is on and they can't go back to sleep. So sometimes that can work better. It can make you a little bit more groggier in the morning than an immediate release. So sometimes that's just dependent, or sometimes maybe a sustained release just isn't a great form for you. But those are things that will help you figure out at Joy.
Awesome. Can you get the troche form through Joy, or is it only the oral?
At this point, I only know about our oral capsules or tablets. I don't see the troches. We also have a cream application for progesterone as well, and suppositories. I want to touch on, I saw a couple of questions about estrogen, estradiol, vaginal, and whether or not that actually causes, increased risk of blood clots. So basically related to estrogen, there are 2 forms that we typically will use for hormone replacement therapy. One is estradiol, okay? So that's typically what you'll find in the patch, in the oral pill, many creams. There's also a very, very gentle form of estrogen, E3, which is called estriol. Estriol is like 1/10 of the strength, if you will, of estradiol. And it's my go-to for tissues that are very gentle, like vaginal tissue. So if you're dealing with issues with vaginal dryness or vaginal atrophy, frequent UTIs associated with vaginal atrophy, estriol can be utilized topically intravaginally and outside the vagina, and it will not increase your systemic estradiol levels. So if you're a little concerned about pushing that too hard, I find that the estradiol intravaginally can increase your overall systemic estrogen levels, as well as sometimes cause some irritable symptoms, irritability in the vaginal tissue, sometimes vaginal secretions or issues with vaginal dryness, in addition to trying to address vaginal dryness if it's just estradiol that you're using.
I think there's a lot of confusion with that. Like everyone's like, if I'm taking estrogen, am I also taking vaginal estrogen or vaginal estrogen? Yeah. And I think when it was explained to me that vaginal estrogen is like skincare, right? Don't think of it as hormones, think of it as skincare. That was helpful for me.
Right. But if you think about like estrogen, so again, estriol, perfect for skincare, perfect for your face, perfect for your vaginal tissue. Estradiol, very strong. I've had some women try to put the estradiol cream on their face and they get hormonal breakouts. So really understanding the differences between those two types of estrogen, and what you're putting on your skin, will have an impact on what you're trying to achieve.
It's really helpful. Thank you. Let's see. What other questions do we have?
Well, Gina's asking about the progesterone and retaining a bunch of water. So she's saying she's played around with her dose and sometimes she can swell up and retain water. What causes that?
Do we know for sure that it's the progesterone, or is it her estrogen levels and the balance between the two?
She's not on estrogen, just progesterone and testosterone.
But again, what
Yeah.
are, it's looking at the whole picture. It's really like looking at, when does she have this symptom? Is it at a time when your estrogen levels are skyrocketing and high during ovulation? Or is it at a time when it should be lower, but it's still high? Is the progesterone really the culprit here, or is it a balance between estrogen and progesterone? Again, I think about like water retention, higher estrogen symptoms. I think about bloating, to be more associated with like progesterone levels being too high.
That
I
makes
think it's
sense.
fascinating to have these questions answered in such a way where we're like, we have to look at the whole picture, because I think as women, we're so used to like having people give us this one quick answer. And then typically that one quick answer does not work for us. But then we're frustrated that we have to go through this process to figure ourselves out. And that is to the point of why our doctors do not have the education, because all of society has told everyone that women are too complicated to figure out. So I want everyone to take a breath and realize that you are worth figuring out. You're worth calling a doctor and going through the symptoms and working through all and looking at the big picture. I know we're used to society handing us a buy now button, and we're not going to be fixed by a buy now button. And that's why we're having these conversations, because you're worth the time and the energy and the effort to go through and look at the whole picture, which most of our doctors have never done before. So that might be a frustrating answer when you're like, we got to look at the whole thing, but that is the answer. Lots of questions in my chat about cycling progesterone. And for someone that doesn't have a uterus, um, do I just take it every day? Should I be trying to figure out how to cycle it?
I'll answer that. So if your symptoms are really, if they really change to a noticeable amount, you could try to cycle it and then, kind of just count, like using an app, or just go old school and write it on a piece of paper or circle it on a calendar, and just try to see if you can take it those 2 weeks out of the month. That's one option. There are some, like Anito, I don't know if I'm saying it right, INITO fertility tracker. Like you can still get some hormone metabolites, even though, you're not having a uterus, but you could use a tracking device to some degree and get an idea. Are you having a rise in your estrogen, progesterone, and sort of kind of understanding where you are in your cycle? And then once you have an understanding, you could just kind of go from that, and take it. You could cycle it in. I totally get that, because I don't have a period either. So I personally take mine nightly, but that works for me. I'll take a break here and there so my receptors don't get so overwhelmed and it still works well. So sometimes I'll take it like 6 nights a week, 1 night off. That's another option. But if you need it every night, that's okay too. So yeah, there's a couple different ways of doing it.
Yeah, I mean, I had an ablation, so I don't have a period, but I use an Aura ring, and when you ovulate, your temperature rises. So essentially, once I see my temperature rise on my Aura ring, then I start taking progesterone until I see that temperature fall, and then I stop. And I do that because then it mimics my natural ebb and flows of my hormones, since I'm still ovulating, because I'm not
Because
menopausal
you're in your
yet.
30s.
I'm in my 30s.
I mean, I really think if women
Right.
start being able to be in touch with their body, even though we're not having, bleeding, I think we would still very much feel the cycle if we were
Yeah.
trained to feel the cycle. We would see it. and it would be so, so helpful. But yeah, it takes paying attention to ourselves, which we've been taught that that's selfish. That's weird. What would the world be like if
I
women
want to
took care of
answer
themselves?
Lisa's question about LCIS and BHRT. I don't know what LCIS is, but do you guys is that a contraindication for hormone replacement?
I don't know what that is.
LCIS? What is that?
I've never heard of that.
Oh,
LCIS.
Oh, it's lung
So
cancer?
in situ carcinoma. So you're going to have providers that have different schools of thought on whether or not it's going to be safe to start any kind of hormone therapy with a history of cancer in general. One of our absolute contraindications here at Joy is if you have active cancer, we will not start you or manage you on any kind of hormone therapy. Once that is non-active, then that kind of opens the books up a little bit. And it really is working with your oncologist to see whether or not you're quote unquote cleared. And again, you'll have some oncologists that are on board with hormone therapy. We've found that estrogen can be very supportive, especially even with breast cancer. And not having estrogen can actually be a little more detrimental and increase your recurrence track. So it's really working with a provider that's very comfortable in dealing with cancers or carcinoma or history of carcinoma. And then also with your oncologist to make sure that we do this in a safe manner. And then with very, very close monitoring, making sure that you're aware of the risks of a recurrence. And if so, like what your path or what your track would be. So we would take anybody's history of any kind of breast cancer or body cancer and make a determination whether or not they would be suitable for hormone replacement therapy. So we'd have to talk about it individually, one-on-one.
These are great questions. I mean, this is really covering all the fears. And I think from this, what I really hope when we have these conversations is there's just a few more women that are willing to try it, a few more women that know they're worth feeling good and that it's possible, that it's possible to feel good. That just because your mom suffered, just because your grandma suffered, doesn't mean you have to. That is not a requirement for being a woman anymore. I think it used to be. And it's just, we're like done. We're like, wait a minute. We're finding out that there are people that feel good now, and it is possible. And it might take some time and energy and effort and funds to figure you out. But this is your life. This is your body. You're not going to jump into another one, not ever. This is it. This is the body you got forever and ever. And I think that when you get to 70, you're going to wish you had done something, because whether you're paying for it now or you're paying for it while you're in a memory care facility at 80, you're going to pay for it. And right now I have a grandma with dementia and we're paying for it. And I would have much rather she spent a fortune on herself at 40 than now. And that's what I'm hoping for women today, that you know that you're worth figuring this out and that this isn't as scary as all of us have been told that it is. It's way less scary than dementia. I'll give you that. This is amazing. I think that we can wrap it up here. Thank you, Kimberly, Susan, and Riley, and Lindsey, and Kate, and Katie. If you all don't know, Katie Wallen is the founder of Joy Women's Wellness, and it is always a privilege to hang out with you, Miss Katie. You are magical, and it is, I'm gonna cry. I get so emotional during these things because it's just like we're watching women finally feel good. I mean, for me, 2.5 years ago, when I told my story, I had no idea I was walking into a world where women felt dead inside. I didn't know that providers like you even existed. I thought I was stuck in the system and that's all that there was. And to find out that all of you exist it changes the world I live in. It gives my sisters hope, my daughters hope. It gives the whole world hope that there are actual doctors here that are listening to women and helping us feel good. So thank you for all the work that you have done to put this together. And thank you to all of you providers for finding the education necessary to help women with what we actually need. And for all of those that are here hoping to feel better, I hope this gave you hope. I hope that you will take action. I hope that you will call Joy, go to choosejoy.co and get your blood work scheduled because it matters. It matters to the future of the whole world, but it also matters to you feeling good. So go do that. And thank you, everyone, for knowing you're worth the time to even be here. Thanks, everyone.
Thank you. I do want to say, so we posted the Wake Her Up group. You can always ask questions there. If you're not a member there, go join there. I'm also going to post the Joy IG. We're going to do a story where you, if you didn't get your questions answered, we can answer there. So there and the Wake Her Up Facebook group, we can always answer your questions at either one. So join us both of those places.
Amazing. Thanks,
Thank
everyone.
you, guys. Thank you.
Thanks.
Bye, everyone.